Good afternoon. Today we're here to talk about the use of restraints in hospital settings. We are looking for funding from your agency because we feel there isn't enough research on whether restraint use leads to an increase in depression, anxiety, or self-harm in patients after they've been released from the hospital. We know there have been many initiatives to limit the use of restraints, like those reported in the Journal of Nursing Care Quality, but there have been limited initiatives to study on what happens to those patients after they've been released.
According to Mangal et al. 2023, restraints are used in healthcare settings to manage patients' violence and aggression towards themselves or others. Some common restraints are physical restraints, such as limb straps, chemical restraints, such as IM injections, environmental restraints, like secluded or locked rooms. Restraints are used when verbal de-escalation or communication strategies fail. Although restraints are necessary for patients' violence, they have also led to negative experiences for both patients and nurses.
Further, restraints have led to anger, abandonment, and the re-experience of previous trauma in patients. Restraints have also led to fear, stress, disappointment in nurses who were upset that they couldn't verbally de-escalate a patient. Although nurses understand the importance of restraints, they also understand that restraints violate patients' autonomy and dehumanize them. Thus, the use of restraints is a subject of matter for policy and legislation makers. Mangal et al. 2023.
Based on Hall et al.'s 2018 research, Restraint Management Bundle emphasizes that gentle reminders are often enough for patients not to disrupt medical devices or tubes or get out of bed unassisted. Prior to implementing RMB, the nurses would immediately opt for the most restrictive device, such as soft wrist restraints, rather than trying less restrictive measures. However, after the RMB education, the nurses began to use less restrictive devices or not restraint at all. As per BCCNM, restraints are used only as a last resort by the nurses who have the legal authority to do so for behavioral management purposes.
With the support of the granting agency, you're not only investing in a safer, more compassionate healthcare system, but also in the well-being and dignity of countless individuals.
Together, let's unlock the future where restraint-free care is the norm, not the exception. Your funding can make this transformative change a reality.
Thank you.